Good evening. I'm John Bailey, and this is People to be Heard, the program where people who have something to say have their say. Tonight, you've got Paca Lipovac. To my immediate left, she is the president and CEO of Richmond Community Services, and she is joined by Matenah, the director of human resources for Richmond Community Services. And just for a little background for you, Ms. Lipovac, Dr. Lipovac, right? Yes, has worked for Richmond for 9 years, and she is in her second year as president, and the organization provides homes for 169 adults who live in the Westchester area, and also a day program and many other services to the disabled. And would you say you would be basically the leading provider of such services?
We like to believe we are. We are not the largest, but we are really excellent in what we are doing.
Right. And they are here to discuss the situation of the disabled in Westchester County today. And what do you see it? What is the situation that the disabled face going forward?
Well, in terms of trying to find a placement for your child, if you're a parent that has a child with disability that is aging out, and as a parent you can't take care of your child any longer, or your child wishes to be independent, the situation is pretty serious. It's getting to a point where it's critical because there is a large number of people there seeking placement and very few opportunities. Because right now the state is committed to provide living opportunities, group homes or apartments at different levels to people who are coming out of residential schools. There is really no development for people who are not in residential school, who are staying home with their parents or living independently and seek a higher level of support. So it's getting really serious because there are more and more people, and pretty much the state now developed a priority list, and on that priority list, your child or the loved one gets ranked depending on your particular situation. So unless
How many are on the list?
I don't know exactly for Westchester, but I can tell there's several thousand for the state of New York.
Several thousand.
Yes,
for the state of New
it's a
York.
very long list. There are about 1,900 people that enter system every year, either through residential schools or simply the number of people with disabilities is greater and greater.
So it's growing exponentially.
It's growing, yes. You know, if you're looking at statistics for autism, 1 in 60. Some statistics in New Jersey are saying even 1 in 48 children have autism. So it's really growing, and it's much larger than what it was before. So the need is growing, and the supply of appropriate residential opportunities is not.
Yes, as well as the staffing to service. You've opened 3 group homes in the last year. Quite an achievement. Now, what's involved in doing that, Matenah?
As far as the program,
Personnel.
the challenge is once we realize that we're opening a home, we immediately look at the individuals that are coming to the home and find out exactly what their needs are clinically and the number of staff that are necessary in order to provide those services. And then we immediately start to do recruitment. Well, after we do our staffing plan, we do recruitment. And what we look for is a person that can come to the table and provide the care, the nurturing, but also the mindset, the judgment, the decision making, the skills that it comes twofold. It's not just I need someone who can provide a nurturing and home care, home environment. I need someone to come with thought and decision making skills. So we start by recruiting through various community service programs. We also do online recruitment. And we have a new service that we've hired since last year, Talentel, which has been a great help in evaluating a candidate's suitability to provide adequate services for our residents. And then we spend our interview time doing more behavioral interviews where we're exploring your decision making and your judgment skills to get a better fit. We want longevity, and we want people that have the right mindset and the heart. So we work very hard in making sure that we get the best
What
fit.
is your personnel need now? How many persons are you looking for this?
We have an ongoing
care?
need, and I would say right now, I would say for direct support professionals, we're in the realm of about 70 vacant positions.
70?
70.
That's
It's not the
astounding.
easiest. Yes, and the further north you go, the more difficult it is and challenging it
Because
is.
the computing problem. Well, anyway, I'm going to put up a slide of your front page website with a phone number that they anyone
Yes.
interested can call
Yes.
if they're perhaps interested in exploring
Yes.
this line of highly meaningful but not well-paying work. And in fact, you've recently gotten an increase in wage for workers.
Well, there were
Everything
two
or not?
increases this year, one in January and one in April, which was 2% each, which is really not a high increase, regardless of your salary level. At the level where our staff are paid, as you said, it's not a well-paid job, and it's a difficult one and requires people who really primarily have the ability to work with people with disabilities and provide them appropriate supports, but also, as Matenah said, we need people who can provide appropriate judgment. So the job is not the greatest paid job, and 2%, although it's nice to get an increase, it's really not a significant increase, and we do appreciate that the state consider giving that increase, but it's not making a world of difference in anybody's life, especially now when you have these fast food joints go to $15 an hour. Kind of hard for us to compete. Well, maybe we are hoping we'll go there as well.
Yes.
But as you know, it's a big debate, and everybody's putting their 2 cents in on how they should go.
True, but no one thinks about raising the care for the workers who are doing a lot more. And I can't praise the organization enough for the people that work with my son.
Thank you.
Yeah, and what now is ahead? What are care organizations like yours needing from the state going forward? You need a lot, but what do you need most of all?
Well, most of all, what we really need would be the stability and the knowledge what's ahead and what's going to happen going forward. The system's been in a transition for since 2008, pretty much. Things have been changing. Our reimbursement has changed, and when I say reimbursement changes, it never goes up. It, for the most part, goes down.
Yes.
So it's a very, very difficult situation. The system, OPWDD system, Office of People with Developmental Disabilities, does not have a permanent commissioner. There's only an acting commissioner right now. Although she is a lovely lady and doing a lot of work, it would be nice to know that there is a permanent commissioner so things could move forward in a different direction. So in terms of what we really, really need, I mean, everybody needs more funds. That would be really nice. But I think we would all feel better if we knew exactly where we are heading and what is that that's ahead of us. Yeah. Because that would allow us to create systems, because the target is really moving. So we are continuously adjusting to kind of get to the target that's somewhere in the dark or in a fog.
Meanwhile, the population that needs serving, as you pointed out, is increasing much more. How long does it take to open a new group home, say, servicing 10 to 12 people? About 3 years?
It takes anywhere 2 to 3 years, because the road is rather rocky in terms of what's required. There is something that's called Padawan law, which was a groundbreaking law in the state of New York after Willowbrook School closed, because Padawan law allows us to allows the group home to be considered a home, not a workspace. So we wouldn't then violate zoning. So people with different last names are, by Padawan law, allowed to live in the same home and be considered a family. While Padawan law is really lovely and it's a great thing that we have that, on the other hand, it's really allowing the community to say no to us. And, you know, as somebody who dedicates her life to assist people with developmental disabilities, I find it offensive that we have to ask the community, is it okay to have a group home in a community? Yes.
At the same mindset they were about 15 years ago?
Pretty much.
Really?
It depends on the community.
Yes.
Some communities are lovely, other communities are not so welcoming. And that creates, so you have to first find a house that is going to meet financial guidelines from OPWDD. So you can't go over the threshold at OPWDD. Then you need to go through Padawan application. And if the community says, no, you cannot be here, then we have an opportunity to go to a commissioner's hearing and have the commissioner of OPWDD decide if we should or should not be a part of this community. And after that is the asking for all the permits and everything else and building the group home. Easily 2 years.
The state is never going to catch up with the housing needs for adults needing this
Well,
service.
I'd like to hope they will at one point.
They've
but
done really very little the last 7 or 8 years,
yes,
right?
in the last few years, it's been very
They've
little
forgotten
done.
it, basically.
I think the funding got tight in 2008 when the economy went down, and when the funding is tight, it's kind of difficult.
Yeah, but the governor gives away millions a day. I get the press releases to all sorts of situations, and it's something he should take a look at. But at any rate, the Office for People with Disabilities is devising a new process for evaluating children and adults and how they get services and what services they can have. Could you tell us where this is?
Well, there are two, to my knowledge, there are two, actually, that's what we got the information about, two different systems in terms of evaluating the needs of people with developmental disabilities. Because right now, there is a system that is called DDP-2, Developmental Disability Assessment, that's done, and it's very vague, and it kind of doesn't quite describe the person. OPWDD is putting forward this new system. One is the CAS system, and the other one is another evaluating tool. And knowing from our experience as an agency, they are piloting those two systems right now to see which one they're going to use, which evaluating tool they're going to use. Basically, with the way that the system works right now, anybody living in a group home, we get the same rate for each person in a group home. Pretty much until a few years ago, we would put a budget together and we would present it to the state, and the state would approve it, and the budget would be for the house, not for people living in it. So now going forward,
It's certainly not the way.
it's not the greatest way, but it was the way that we've done it for 30 years.
Yes.
And now the new system is that the state is going to evaluate everybody based on their abilities, based on their likes and dislikes and what they can and cannot do. And that score is going to actually translate in a dollar amount that we will be paid at one point. So conceivably, if you have a group home of 6 people, we could be getting different rate for every person.
But who will be actually making the medical needs decision?
Well, that is where our concern lies, given that we are an agency that has a high number of people that are medically frail or have very complex medical needs. It is a concern that those people will be forgotten or will not be evaluated appropriately. Unfortunately, we were not offered to see those evaluation tools, so we don't know yet how is that going to impact. But we remain concerned that our residents that traditionally kind of get left out because sometimes when we talk about people with disabilities and this notion that everybody should have a job and everybody should be out there working and being productive.
That old positive outlook.
Yes. It's kind of putting really on margins people who have significant disabilities, especially people with complex medical needs.
Yeah.
And we have a high number of residents that fall into that category. So we are always concerned that this new system is not going to capture the medical necessity of our residents. And that is going to decrease the funding for them.
Have they done away with the thoughts of a couple of years ago, whereby physicians would suggest what needs a client has, and then it would go before a panel, and they would decide? Is that still in play?
No, not really. This new
that's good to
evaluation
hear.
tool will be done, and once the results are there, that is going to determine. But again, I don't know how the evaluation tool looks exactly. I don't know what encompasses. So we will have to wait and sort of see. And as I said, the state is piloting that. They are evaluating several of our residents, and we'll see. I have to say that I feel in the last year or so the state is doing more of a due diligence in terms of evaluating people that have very complex needs. And right now, several of our very complex, medically complex residents are being evaluated with two different tools. So we'll see how the results come out.
Yeah, but I mean, they've selected my son to be part of a survey that they're doing. I signed the papers yesterday. And what I was interested in is they need, when they're evaluating an adult or in your care and what services they need, they've got to look at all those past records, right? Now, you have to evaluate them when they're in the homes. And when it sounds like creating an educational system and policy without consulting the ground level. do you feel that they are inclined to do that?
Well, as I said, I don't know what the tool looks like, so it's very difficult to have an opinion.
They're not talking, they're talking to you, right?
They are just, the way that I know about,
Yeah.
by my position, I represent some of our residents who don't have family to represent them. So they picked several of those residents to be evaluated, and the same as you did, I reviewed the consents and signed consents, but didn't get much more information on it. I have to say that I do have some concerns that look into past medical history may not be so deep, because these interviews are not.
That is the problem, because
are
the
not
medical
very long.
history, and really, when you tell persons that are thinking of taking your son, and you tell them his past history, you suddenly realize they haven't looked at it.
Yeah.
They haven't looked at the massive records that follow him through his life, and this is a big disconnect in the medical business, to say the least. Every doctor wants to make his own judgments, and he ignores a history. It's like looking at a baseball player and not looking at the past stats. You would never do that if you were a baseball executive. But these people who make decisions ignore, and this has been my experience. You can talk, but people always have to experience it themselves. Meanwhile, time is lost forever.
That's true.
And this is how do you feel? You think there's a better attitude towards this for this new system? Or is it mainly a money-saving effort?
I don't know. I think that the state of New York is, as we talked about, the state of New York got itself in some hot water with the federal government because of certain regulations that were in effect prior to 2008. And the state has certain mandates from Centers for Medicaid and Medicare Services that they have to follow. And the money simply has to be saved. When you think that New York State is the largest Medicaid system in the country, there are over $50 billion spent on Medicaid. I understand states need to save the money, because you don't want the system to continue to grow in a way that's not controlled, and then the system becomes unsustainable. But on the other hand, we need to make sure that the system is done in a way that is going to support people who need to use the system, and is going to support them in a ways that they need to be supported.
Have they cracked down at all on the overbilling of care for the handicapped?
Well,
strongly on hospitals.
Yes, Office of Medicaid Inspector General is a very active office, and they are really catching, and that corporate compliance is really being pushed and enforced, which is a good thing. It's not an issue for ethical agencies, but it is an issue for people who overbill and bill for services that they don't provide.
Keep disabled persons in the hospital far too long.
Sometimes the issue there is that the receiving agencies are unable to provide services that are necessary for that person. That also is an issue, because there is lack of agencies who are capable of supporting people that have a lot of medical issues.
Well, that's granted, but there are some others that take advantage of their ability to say, oh, they're not ready yet to come out. Now, what... the former state senator, Nick Spano, is your chairman of your board, and he has been your chair for a couple of years now. What does he bring to the table? Because he's one of the few legislators I know of in the last 10 years that has really looked hard at the disabled issue problem. What is his efforts?
Well, Senator Spano's been a great champion for the field of disabilities. Way before I met him, I knew about him and all of his work that he did, and he was always well liked by all the developmental disability agencies because he really championed the cause in Albany and made many positive changes. We're very fortunate to have him as a chairman of the board, because he is bringing the knowledge of Albany and how things work, and also the ability to give us some information or to request certain information for us and to advocate for the agency, which is really a great thing. He also, is able to promote the agency and support us and advocate for us in any venue that he goes to. The the real good thing about him, he truly understands this field and he truly cares. So for me, given that he's a chairman of the board, he's my direct boss, it is really nice to have somebody who understands. It is really nice to have a boss who gets what is that we do here and fully supports it in a way that comes from understanding, because he really truly understands how the system works, and it is really wonderful to have him on our board, especially to have him as a chairman of the board.
Right. Do you feel that he has been able to rally other legislators to the disabled cause, like Assemblyman Matenah did 2 years ago when that funding cut was proposed?
Yes, and I think things moved in a more positive direction since then, and I think that things are slightly brighter. I wouldn't say necessarily much better, but the outlook seems to me a little brighter, because there are more and more people in Albany who are understanding this. Although, you know, I think we really need to step up the advocacy. I think we need to be there, and we need to, us as providers, but much more families, because, you know, we as providers could always be accused that we're just trying to drum up more business, which you don't go into nonprofit world and you don't go to social services to make horrendous amounts of money and drum up more business. You really go because that is the right thing to do, and you feel your calling to do that. So it's important that we have families and people with disabilities go to Albany and start advocating for themselves.
Yeah, that worked very nicely 3 years ago when they stormed the legislation over that $300 million cut. And now, going forward, is the state looking at building rather larger facilities to house the disabled?
No.
They are not? They're still
not.
looking at the group home model?
Group homes, they're smaller. Group homes, there are 4 people per group home.
But we're not going back to the large
We are not going back.
housing.
No, actually, the state is working really hard to downsize and close down. They're almost done with closing down all developmental centers. They were run by the state of New York, and they are pushing all the agencies to downsize their large facilities. Some facilities will be grandfathered, but not more than 14. Any facility that has more than 14 people, we will have to see what we're going to do with them. The state doesn't have a clear picture of what needs to be done, except that there's a mandate from the federal government that they need to go away.
Yes. Where is that at now? Is there any plan about how many homes they need to build in the next 10 years? Nothing like that?
Not quite.
Why don't they project out? Any reason for that? Is it bureaucracy?
I don't know. I think there are several issues. I think it's the issue is the mandate from the CMS, and the state has to produce this waiver that will go to CMS and be approved. The move into managed care, and at the same time, this great number of people entering the system. So there are a lot of things that they need to work on at the same time. And so with this mandate, what the state is really pushing for right now is that every group home that is considered ICF's, intermittent care facility, which is a federally regulated facility, that they be converted into IRAs, which is a state form. And the difference really truly for somebody who is out there and just listening to this, the difference really truly is how it gets funded and how the paperwork is done. But so ICFs are all inclusive, and all services are in the ICF within the price that we get for the care of anybody with disabilities. In an IRA is it's much more as you and I would have it at home. You know, you don't have a
IRA is what we're moving to.
Yes, IRA is what we're moving to, because you and I don't have a doctor coming to our house or a nurse. If we need a doctor or a nurse, we go to them. So IRA is that more of a home, normal life kind of a model.
Right. Now, do I understand that by going to a managed care, this would be somewhat privatized, or would it still be?
We don't know that yet.
We do not know that. That's a huge issue.
This goes I don't think Medicaid is going to get privatized. How the money is going to be distributed, it's a very different story.
Well, how the state manages the Medicaid money that they get
Yes, we heard the same story for several years, and now the story is changing. So I can't give you an intelligent answer.
So who makes that
exactly
decision to change the story?
The state does.
The state
Along
does.
with the Centers for Medicare and Medicaid Services, because you have to keep in mind that 50% of Medicaid funds come from federal government, and the 50% comes from combination of state government and local governments.
Yes, and with the distinct possibility that we may have a change in philosophy in Washington.
That is
That
quite
is
possible,
not a good thing.
and
for
it's
New York
always
State.
possible. And it's always possible when
Yeah.
the elections at the presidential level are happening.
Yes.
So that is something that we'll have to wait and see and do our part to make sure it sways our way.
Yes.
People have the right to vote, and people have the ability to do that and put their vote out there.
Yes. Well, you have to vote your self-interest,
Yes.
and you cannot vote a nebulous thing. That's what the problem is. I'm going to put a slide here, and you have lots of questions that can be answered by your staff. And that's the number to call, and that is the website. And
Yes.
what kind of services can you provide with parents who might be interested in what you've said on this program and how it affects them?
Sure, we provide residential services. We have 14 group homes and only one opening in a group home. We are slated to open
Only
up
one?
only one opening out of 169 beds that we have. We have day program services. We have 2 sites, one in Yonkers and one in Mount Kisco. And we also offer Medicaid service coordination, which is the person that assists families in obtaining services. That would be the first step. If you need to get OPWD services, you need to get a service coordinator who will then assist you in getting services. So those are the services that we provide. You know, we do in our ICFs. We do also rehab services. We provide physical and occupational therapy and speech therapy. We have psychology department. So we do a number of things.
Okay. Now, we have about 40 seconds. Is there one thing you really want to say to the people out there straight away?
One thing that we need advocacy. We need an advocacy from everybody. We need advocacy from parents and families, because you cannot allow things to just slide the way, as you mentioned, we're just driven by the money, because that's not the way that we can support our residents. Not just our residents, but all the other residents. I feel very strongly it's my job to advocate for everybody with disabilities.
Thank you. And Paca Lipovac, President CEO of Richmond Community Services, and Matenah Drew, Director of Human Resources, you have been heard. John Bailey, good night.